Today we're going to look at methadone maintenance versus 180-day psychosocial enriched detoxification for treatment of opioid dependence. While many people suffer from drug addiction, methadone treatment has been proven to improve the quality of life and even decrease the use of heroin behaviors, which can cause criminal consequences. Evaluations of drug use programs have shown that substance usage is often reduced. While many people support methadone maintenance treatment, or MMT, as a beneficial treatment, this is a hotly debated issue. Some say that is an effective treatment that could end lifetime addictions to opioids, while others say poor results and relapses can too often happen. The fear of the program is that doctors are simply replacing one addiction with another. Methadone maintenance treatment strictly offers drug therapy without the psychosocial therapy that many believe should accompany the treatment. M180, or the 180-day psychosocial enriched detoxification program, phases out the use of methadone and replaces it with psychosocial therapy. This could prove to be more useful than other programs, such as methadone treatment. The study was supported by the University of California and conducted at the Veteran Affairs Medical Center in San Francisco, California. Participants in the study were assessed on a standard baseline and then monthly over a 12-month period. In the first 6 months, urine samples were taken each week from both groups. In the second 6 months, the M180 group were sampled monthly and MMT group were sampled weekly. M180 participants may have had less motivation to continue with the treatment due to methadone being discontinued and psychosocial services continued. In all groups, urine samples were closely examined to see if the drugs THC, heroin, and cocaine were present in the bloodstream. Doctors determined a test to be negative if the participants were found free of cocaine and other opioids for 30 days. Patients identified as having conditions such as PTSD, personality disorders, depression, alcohol, or drug habits were limited in the test. Each patient was tested at 6 months and 12 months for risk of HIV behaviors. Individuals who qualified to be in the study and gave consent were given the baseline assessment. Participants were tested the day before beginning the trial, and if they returned the next day not in opioid withdrawal, they were granted a random spot in a treatment group. Both of the MMT and M180 programs, the daily doses of methadone began at 30 milligrams per day and was raised after 3 weeks of the study, and dosage was never to exceed 100 milligrams per day. Dosing was done 7 days a week. If 3 days of dosage was missed, then reevaluation of participants was done before the program was allowed to continue. If 7 days were missed, participants were automatically dismissed from the program. MMT participants in the program were given 14 months of methadone maintenance, followed by a 2-month detox. The 14 months of maintenance was used to assess how the participants responded to the program. Group therapy was required for all participants during the first 6 months of the program and was optional for the final 6 months. Individuals were required to have personal therapy once per month, and group therapy once per week. Failure to participate in the therapy portion of the program was an automatic dismissal. The program is sometimes difficult to complete. 24 participants in the MMT program were removed for failure to comply with the rules. Participants in the M180 group were given 14 months of drug abuse treatment. Months 1 through 6, participants had 120 days of methadone maintenance and 60 days of reduced doses of methadone. The first 6 months of the program required group therapy for drug abuse if cocaine was present on the baseline drug test. Extensive group therapy was required until the participant was completely clean from the drug for 30 days, and 2 test results had no cocaine usage, followed up by 14 weeks of solitary therapy. During months 7 to 14, participants were presented with 8 months of non-methadone treatment, which continued to offer therapy, both group and solitary sessions, weekly, and other services such as social services and medical clinics. 40 M180 patients were dismissed from the program for failure to follow rules and policies. Participants who did not follow rules were given a second chance in treatment, which was a non-methadone treatment, as the participants were no longer qualified to continue methadone treatment. While both group assessments were deemed effective, assessments showed the use of opioids had little change reported until month 5. After month 5, the M180 group appeared to have greater use of opioids until month 12, when the MMT group eclipsed M180. Opioid use was greater than 50% for both groups at any time the analysis was done. A second analysis was done to see if the drug use was decreased. This report was on the Addiction Severity Index. Use of heroin in the M180 and MMT did decrease from the beginning of the trial, but the MMT radically increased in the final 6 months. Both programs had high-risk behaviors for HIV between the 6-month and 12-month mark. The HIV drug risk behavior was lower for MMT, although participants reported after doing heroin, MMT had less use than the M180 group. M180 participants showed a lower use of cocaine than MMT in months 4 to 7 and 9 to 12. M180 also had more dropouts in a shorter period of time. The Addiction Severity Index for alcohol abuse during the treatment was low and appeared to have no effects on the study. In conclusion, methadone maintenance treatment was found to increase retention and was more efficient at lowering heroin use, and MMT resulted in a lower risk for drug abuse, HIV actions, and had lower ASI scores following 6 months. Cocaine rates for both groups is still a large matter of concern. A low methadone dose does not seem to account for failure or stopping the use of heroin. When the study began, only 50% of participants said they wanted to be fully off of opioids. M180 dropout rates were higher during the whole study, but dropout rates accelerated after 120 days, which is when the dosage of M180 was decreased clinically. M180 was given psychosocial treatment for the continued cocaine use, but this group failed to decrease the use of cocaine. Psychosocial treatment has been proven to help with cocaine usage, but could be argued that a more special therapy be geared specifically to cocaine abuse would have helped decrease the use of cocaine. MMT was more successful with cocaine users in the study than M180 was. Although M180 kept more cocaine users in the study, it did not seem to lower cocaine use. M180 did not show that psychosocial services worked. While the study shows of improvements, it's not enough to say that drug abuse was improved by leaps and bounds. My resource for this presentation is the article of Methadone Maintenance versus 180 Days Psychosocially Enriched Detoxification for the Treatment of Opioid Dependence from the Journal of American Medical Association, which was published in 2000.